They observe, they support, and they collaborate on IEPs along with just environmentally making sure everything is okay. And then obviously you have audiologists and pediatricians and psychologists who work around early childhood educators and SLPAs and SLPs. On the screening and assessment side of things, screenings are quick checks to flag potential concerns and are usually taken by tools like the PLS-5 screening test. That's a pretty normal one, or the ages and stages questionnaire. On the other hand, assessments are more in-depth and consist of standardized testing, parent interviews, observations of the SLPs, observing the child in a structured play setting, so maybe like play-based therapy, where the child kind of leads what they want to do and then you interact with them through that. And then once a child is evaluated, they can get diagnosed, which requires consistent evidence across settings and standardized testing results. So it's both of them. And then early identification of children's language is so critical, as I mentioned before, because it leads to early support for the kiddo, hopefully catching their diagnosis early enough for quick help and not a long road to fixing their impediment or whatever it may be, their delay. Special considerations are ethics and culture. So the ASHA Code of Ethics are principles and rules that protect the welfare of individuals receiving services and promoting ethical behavior. These are what all individuals in this field of work must adhere to when providing care. And then on a Christian cultural level, as a Christian, we must look at diagnosis and testing from a compassionate point of view, wanting all families to feel valued, heard, respected, and appreciated, ultimately making sure that they know that their diagnosis or their impediment or their delay is not who they are, what their identity is, and kind of point to where their identity is found. Tools that might be used to test or diagnose must be appropriate for the child's languages, dialects, and background. If interpreters are necessary, making sure that they are there, and then ultimately making sure to honor family values in care decisions, whatever that care may be. Strategies or treatment approaches, the number one thing would be speech therapy. Getting more specific, I found 2 different types of therapy. So traditional articulation therapy that focuses on the motor side of speech production, so like helping children learn to position their tongue in their mouth, their lips, their jaw, everything to produce specific sounds correctly. Phonological therapy looks at underlying patterns of errors, with the goal being to improve overall speech clarity by addressing the rules and systems of sounds. So those are the 2 underneath speech therapy that I found, but there's a whole bunch of speech therapy related things that can help with this because it is pretty common. Educational outcomes. Ultimately, as I said, timely identification and interventions, and this could include wanting to prepare the child for that transition to kindergarten. That is a big transition for a lot of kiddos, so wanting to put them in a position to succeed, enhancing their social readiness and social capabilities, to improve their self-confidence, reducing the risk of ongoing reading, writing, and academic problems to help them succeed in the future is also a really big goal. So yeah, that is speech sound disorders in specifically preschool years, but overall childhood language disorders in preschool years. Thank you.